thanks for joining us. Us. This me and Stanley, and he's photobombing today. So, my name is Lisa Nielsen, and I'm your AFLAC agent. I'll be your AFLAC agent for as long as I am around and not retired. I've been with AFLAC for a long time, and I love what I do. So if I can be of assistance to you, be sure to let me know. Then I would like to first go through the claims process, because if you have a claim, it's important that you get your claims done. As long as you've had your policy, you can go back as far as you can up to your effective date, and we can do a claim. And if you need help, be sure to let me know. My information will be at the very end of this video. Then the claims process is pretty easy. There's an app you can put on your phone called Smart Claim, and then you just kind of upload it and all the information that they need, and you can have your money in your bank account the very next day. So that's really very nice. All right, the next thing I'd like to do is go through all of the products.
Let's get started. The first policy we need to talk about is the short-term disability. This policy pays you when you are too sick or injured to work. What you do need to file a claim is a note from your doctor that says when your return to work date will be, and with a diagnosis. And you can do that claim over your app, the Smart Claims app, and then you just submit it through your phone, and it's super easy. And then you can get paid on this one pretty quick. The reason that you do want a short-term disability policy is because if you're not working, who's paying the bills? And if your spouse doesn't have a better job than you have, you probably will be caught short either way, but it at least, you have a 60% up to about 70% actually of your income can be available to you with a policy like this. The rates for the short-term disability are right here. I'm going to zoom in on them a little bit so you can see them a little bit better. And it starts out with the AFLAC short-term disability. It has elimination period of accident sickness of 1414, which means that that's your waiting period. You do have to wait for at least 14 days on this election to be able to be paid. Now, if a real popular one for young women who are wanting to have a baby is the 07, because you have a 0 waiting if you're in an accident, 7 days waiting if you're sick, and 7 days is the least amount you can do. So if you're planning on having a baby, a lot of the young women will have a 0 on the accident, 7 days waiting, and then they'll go the maximum they can, which makes it a little bit more money as in your premium. But you know that if you have this policy and you do it right, that you'll be able to have a benefit of, a defined benefit. Now, another thing that really makes it super easy to remember is that if you are planning to have a baby and you pick up this policy for that purpose, remember that AFLAC says one of the little exclusions in this policy is that you have to have you have to have this policy enforced for 10 months before the baby is born. So what I always say is, if you pick up this policy, then wait for 2 months before you start trying to have a baby, and then it will pay off. And then just keep it on board until you end up not having any more children, and then you can drop it, because then you know, well, but by then you might have had another disability or two. One good way of using the policy like this is for, let's say it's not pregnancy, because pregnancy you're usually out for 6 or 8 weeks, so you're well within the 3-month time frame. But let's say you have an accident and you roll your four-wheeler out in the desert and you break your arm. And what if they say, you know what, you're going to need surgery on that and you're going to be out for 5 months? Well, hopefully you've picked up a disability for the 6th month so that you would have, but you could do a 14-day waiting period, because you might have 2 weeks of sick time and vacation time that you can use for your waiting period, and then you have the 6-month policy, so it will pay up to 5 months. Whatever your doctor says you have to return to work, that's when Aflac will stop paying you, unless you get a continuation on that if you have some complications or something. So if you have any questions on this, please feel free to call me, text me, or email. And we're going to go forward to the Plus Rider. What the Plus Rider does, Aflac Plus Rider, is you have a lower out-of-pocket cost with this policy, because you have a benefit of $5,000 if you have any of these 15 Tier 1 critical illness event benefits. So you have a heart attack, stroke, coma, paralysis, type 1 diabetes, traumatic brain injury, advanced Alzheimer's or Parkinson's. Any of those things that you have here, you will get paid $5,000. Again, you do have to have the billing, you have to have a diagnosis from your doctor. There's certain things you need to have, but as long as you get that in and do your claim, you would receive $5,000. Now, if you don't have a $5,000 deductible, let's say you have a $2,000 deductible and you get $5,000 in the mail or in your direct deposited into your checking account, which, by the way, is the way to go, because you can have a lot of these paid next day pay. So if you do all of the paperwork and you put all the claim in all at once, and you will have it paid the next day rather than having to wait for mail time if you have a direct deposit in the system. So if you need any tips on setting that up, let me know. I can help you. The $5,000 benefit can come to you pretty quick. And then let's say you actually have a stroke which causes a permanent loss of speech, or a traumatic brain injury that causes a stroke. Those two things are both on that Tier 1 critical illness event. So if it's the same onset date as so if, like, your traumatic brain injury caused a stroke, then, and it's on the same onset date, then one would pay out at the $5,000 and the next one would pay out on the $3,000 level. So that you kind of get paid twice, but not as much on that second one. But let's say you have a heart attack, and then several months or a year later, you end up with Alzheimer's. Those would both be covered under that Tier 1, where you have, this $3,000 one. It can be a little bit confusing. If you have any questions about it, then give me a call, and I'll help you understand it. The Tier 2 critical illness events are this $1,000 onset, with $1,000 onset of any of these 9 events. So you've got encephalitis, meningitis, Lyme's disease, any of those that are listed there, you would have $1,000 coming to you. But they're not payable on the same day as the tier 1 critical illness. So if you have Lyme's disease and the same day they diagnose you with a heart attack, you would only get paid on the heart attack, the $5,000 one. And then if you do have to go through an coronary artery bypass surgery, then that's an additional $2,000. And that's only payable one time per covered person per lifetime. The cost for this, it will be listed here. And as you can see, it's broken down into per paycheck amounts. So if you, and it's also broken down into age groups. So if you fit in the 18 to 29 group, then you follow that across and that's your premium. If you're in the 50 to 70 year olds, then you follow that across and you'll find your premium there. Then our next one that we want to cover is the cancer. And cancer is great. Cancer is not great, but this policy is. And you probably know that Aflac began with the cancer policy, and for 50 years, that's what we offered. And then they added this and that, all these other policies on top. But it was that cancer policy that really got us started and got us as stable and as good in the ratings as we are. And we're like top level, top shelf ratings. So this is the option 2 level, and that does go up to option 4. The benefits are be listed all the same, but the amounts that you would be paid is different. So if you wanted a level 4 policy and this is level 2, then we'll make that adjustment and you can have whichever level you want, or you can step down a level to level 1. So the cancer screening benefit once per year per covered person, you would get $75 on this level. Now, keep in mind that's per covered person. So if you and your spouse both had your cancer screenings in the same year, you would get $150. And if you have children on the policy, then you would get $75 for each of the children that have a cancer screening. It's really nice, and it does pay up to children up to 26 years old. You can have them on this policy. Also, you can have more than one or two or three children on this policy. So in the end, what happens is you would get paid per person per calendar year, one time per calendar year, $75, and you just add that up. Now, some of you probably have received in the mail from me a letter that says that we owe you money for a cancer plan or an accident plan. Well, that would mean that you haven't filed your wellness. Keep in mind that you do have those benefits coming to you, and you get paid for those. And we can go back several years if you need to. Just give me a call and I can tell you which years you're missing and how to do it. Then these are all the benefits that you have is on this cancer policy are listed here. The initial diagnosis, where it says named and insured or spouse, is $4,000. Dependent child is $8,000. They'll pay you double the amount for a child as they will for you or your spouse, because often both parents are missing work because one has to stay home with the other children and the other one needs to take their child to the doctor. Or if it's an only child situation, or if the other children are old enough or in school or something like that, and you schedule that, the doctor appointments and all of the things that go with the cancer during the time when you don't have the main responsibility for your other children, then this both parents often will go with their child. So they feel like, Aflac feels like if you have a cancer happen to your child, that they will pay you more because it's just more tender and it hurts a little bit more because it is your children. The additional opinion, that means the second opinion, you do get an additional $300 per person per lifetime. So keep in mind that that's only once per lifetime. The initial, I do need to back up here for just a minute. The initial diagnosis benefit, also the way that it's priced, it has a increasing benefit rider. So that it means that it will increase by $500 every year that you have this policy. That benefit will increase. So that's automatically added on there in that pricing. Radiation, you can go along this, with me, or you can stop it in between, but it tells you all of the breakdowns. So there's hormonal treatment, there's anti-nausea things, there's stem cells, blood and plasma, surgery, anesthesia, skin cancer surgery. Often cancer policies won't include the skin cancer surgery. So keep in mind that this is a really, really good benefit for you. And then it goes down to hospitalization and outpatient hospital surgical room charge. So that's kind of the cancer policy level 2 in a nutshell. Then you have the pricing. You can see here that it's not broken down by age at all. It's just one age, but you can get yourself an individual policy, individual and spouse, one parent, meaning the employee and children, and the last one is the 2-parent family. And if you follow it all the way across, these numbers are per paycheck there, and you can see how it's broken down. The last policy that we'd like to talk about today is the Aflac Accident Advantage. This one is option 2, and if you look at this one, I'm going to zoom in here, and we'll start with the initial accident hospitalization. When you are admitted into the hospital for at least 18 hours, you would get $1,000. Remember, this comes to you. It doesn't go to your doctor or your hospital. And then if you're admitted directly into the intensive care unit, it's a $1,500 benefit. And the intensive care part of this is it's once per calendar year per covered person. So just kind of keep that in mind. But how often are you really admitted into the hospital for accidents? Sometimes it's a few times during the year, but if you can limit it to one per year, then you're okay. Then if you zoom down here to the accident treatment benefit, that is payable once per 24-hour period and only once per covered accident per person. So if you walk into the emergency room and you don't have an x-ray, the benefit for that is $170. If you do have an x-ray, that's $200. If you walk into an Instacare or your physician's office and you don't have an x-ray, maybe they stitch you up and they send you home, that's $120 benefit to you. If you do have an x-ray in the urgent care or in the doctor's office, that's $150 benefit to you. So the least amount you can come out with an accident would be going to your doctor's office and not having an x-ray, maybe some stitches, but no x-ray. The least amount you could come out with is $120 just to walk through the doors and say, I hurt myself, check me out. There also is an ambulance benefit. There's blood and plasma, major diagnostics, and MRI and CAT scan. There's follow-up benefits. So if you break an arm and you have to wait a few days to go get a cast, and then they take the cast off, those are separate times. That would be 3 times for that accident. And you're limited for those follow-up treatments for a maximum of 6. So you're still okay even with a broken bone. You'd get amount of money for the 6 up to the maximum of 6 treatments. There is physical therapy benefits. There's appliance benefits, so back brace, leg brace, crutches, walker, walking boot. They all have their own amount of money, and you just put in that claim form, and they shoot you back the money, and there you have it. It's great, and this one can be a 1-day pay, so that's nice to put it in one evening before 6 o'clock Eastern time, and you would have the deposit in your account the next day. Then the next little pieces here are rehab facilities. If you're in there for physical injury, that means that it's a rehab facility that has physical therapy, it has speech, it has OT, occupational therapy. You get $100 a day every day that you're in there. Then this is a new benefit, and of course you can keep your old policy, or if you want to upgrade it, then you'd pay the new rate, and you'd also get the new benefits. So if you have to modify your home, like put a ramp in for a short period of time, then you can rip your ramp out. They don't care as long as you have to do that modification. Aflac will pay you $2,000, even if your buddies will donate the material and their labor, and it costs you nothing. You would still get that $2,000. That could be some really nice pizza for your buddies or something. Then there's dislocations. There's these other benefits for treatments. So if you have a dental work done because your mouth hit the steering wheel in a car accident, as long as that tooth was a healthy tooth, then they would pay this amount of money. The 2 amounts that you see there. If you want to upgrade this policy, this is option 2. You can go up to option 4 or down to option 1, and you get to pick, and you can pick the rates that you want. So we just need to talk about that, and we'll go through the rates at the end. The specific sum injuries are things like lacerations, fractures, the dislocations, emergency dental work. So it's all of these things is a specific sum. In other words, when you have a broken tooth happen, this is how much you get. If you're paralyzed, this is how much you get. So it's a specific sum for things that happen. The accidental death benefit is another one. Another benefit of this policy, you have to pass away in an accident. A common carrier accident would be a plane, train, taxi, anything that has a fare, a bus. If you pay a fare for it, then that's considered an accident, an accidental death. So if there's other accidents like your personal car or just falling down your stairs and hitting your head right, and if you pass away from something like that, then these are the amounts that you would receive. And the hazard activities are considered things like rock climbing, heli-skiing, the more extreme sports, those kind of things. Maybe if you were in one of those car, the rallies that you go around and crash into each other, that would be a hazardous activity. Then there's the wellness benefit on this one is $60 once per calendar year. Of course, the higher levels would have a bigger benefit. The lower levels, this one's $60 and the level 1 is $45. On the other side, it's $75 and I think it's $90 for the level 4. So we would have to talk about that when it came down to getting you enrolled. Then if you have any questions on the rest of those, we'll just answer the questions when they come up. The rates for this are broken down into individual, again, in the insured and spouse, or one-parent family, or two-parent family, but there's only one age band from 18 to 75. And then, so your totals would be all the way over to the right, and you can see them there. Now, if you have any questions, be sure to give me a call, text, or email me. And here's a complete list of the policies that Aflac has. You do have in Village, you've got Village Capital, you have accident, you've got the cancer policy, you have I think a few people have either the sickness or the hospital indemnity or the hospital choice. It was an older one. And some people have the disability. You probably also have some vision, life, and dental that people have picked up here and there. So you can have any of these policies. If one of them interests you, or if you need further information about them, let me know, and I can forward you a brochure. We can talk about it. We can do all kinds of things. And then, of course, we can get you enrolled. The last slide is my phone number, email address, and my name. So if you'd like to enroll, if you have questions, if you need brochures, please let me know, and I can help you with that. Thank you for your time.